I think one of the coolest things about Pioneer is the facility itself is beautiful. And we have everything that's pretty close to state of the art. And we're always trying to be that step forward to bring those state of the art things here. So we have a beautiful OR with 2 suites, one for orthopedic or clean procedures, one for colic procedures. We have a CT, we have an MRI. The covered arena is wonderful because we have hard ground to jog our horses on that's not asphalt, and so we're less risk if they do slip. It's a much nicer surface, and we have the arena, we have a round pen, we have all of these things to really look at our horses in many different ways. The facility is fantastic. And that also goes along with the people that we have here, is that you can get a neurologic workup, a lameness workup, radiographs, and an ultrasound in a 3-hour, 4-hour period. Whereas you're going to be hard pressed to find that in a lot of places, to get all of that done in a shorter period of time.
We have access to almost all the toys, so we can kind of be a one-stop shop here at Pioneer. We have the MRI, we have the CT, we have the specialists that can address the things we find on those diagnostics. And so I think that makes us stand out a little bit because we can do almost anything here.
We do really make decisions as a group of veterinarians rather than it being one person making decisions about how the practice is going to move forward. Because we are such a collaborative group, we also collaborate on how to do best for our patients as we advance the medicine here. Clients were seeing multiple doctors. Doctors were standing around talking about cases and trying to use each other as resources to do best by the patient, and really making sure the care was personalized to each patient and each client's financial needs and goals as far as their discipline. And that has really continued to be the beacon of what we work for, is trying to focus on the client experience, the best possible care for our patients, and doing the best medicine possible. And the way to do that is by coming together as a team and putting all our brains together rather than functioning as an individual.
The community that we have here is really special. Everybody's so friendly and willing and open and professional. They encourage everybody to learn and to grow, and most importantly, taking care of our patients, taking care of the clients who love them.
We're very family. We all joke that this is a big family, so we pride ourselves in the Pioneer family.
I think the best part about working here is the team. There is just such a unity and the goal of doing everything that we can for that patient and bring it to that level, whatever that level is. There's just always teamwork, and it doesn't matter if it's a specialty of someone's or someone else's. It's a team effort. We always reach out to one another and say, hey, what do you think about this? Or it's a really collaborative effort here, and we all respect each other. And so I think at the end of the day, we end up delivering a much better outcome for everyone, client and patient, because we are such a unified team.
And I really liked when I started that it was a family unit. As I've been here and things have progressed, I like that we keep growing and we keep advancing our medical technology and the things that we can do.
I think that's one other thing that really sets us apart, is that some places are going to have a little harder time scaling back or scaling up depending on what a horse needs or what an owner is comfortable with. And we are all capable of, giving absolutely everything or giving a little bit at a time and, seeing what works best for that horse. But we have a very scalable way of treating animals. And so we're going to treat every animal that comes in the door to the best of everyone's ability.
I love horses as athletes, as a former athlete myself. I appreciate everything that goes into their career, and when they need help or need to be diagnosed to further their career, that's why we're here. It's a great team effort.
That's sort of unique because you have everything from the 3-star horses to the 3-meter horses to the 1D barrel horses, but you have the people that ride on the weekends and that are just trail riding. So you have all of these level of athletes, And it really makes, as a surgeon, it's so rewarding because we get to see and do so much and do so much good for so many different types of horses.
I love working with the horses, but I also love the aspect of creating a relationship with my clients. I like making people happy and fixing their horse and making the horse feel better and do its job better, but also seeing the joy of a little kid that their horse feels better and they can go back to riding, or an adult that performs on their horse and now their partner feels good again. I love that connection that I get to make with people.
I love the clients. That is one of my go-to things, is to communicate with them and bond with them. I love getting to interact with them when they walk in and I go, how are you? Or how's your horse? That might not be the horse that's coming in right now, but I can ask them because I remember the horse that was here 2 weeks ago. That is my number one thing. Or recognizing their voice on the phone. That's kind of my favorite thing about working here.
I think my favorite part of my job is the problem solving portion. So I get to work through a case with the client in a step-by-step fashion, trying to get them from the problem at hand to a solution. And that I grew up really with a lot of sports medicine experience. And to me, surgery really came to me as something I was excited about because I get to get all the way to the final step of the process and the problem with the clients.
All are striving to make our horses' lives better and therefore make owners' lives better. We want to extend the life of horses, whether that's their professional life, their career, or just extending their life for whatever reasons.
We want it to be somewhere where you can come and we can work up your horse from beginning to end and do as many diagnostics as might be needed and get to the point of treatment as quickly as possible, both to make it the most economical process, but also to get answers for clients. But with that being said, I think the biggest part of our technology is really the way that our doctors focus on staying as up to date as possible with the new treatments and the new options that are out there. We're all really focus on being well-read on the most current literature and making sure that we also use our interns as a resource to be inspired to continue doing that. So we want to make sure we provide them with the most modern education as we can and our patients with the most modern treatments that we can.